Dr. Frank Ebert is a board certified, fellowship trained orthopedic surgeon and joint replacement specialist. He's going to walk us through why hip replacements can fail and when it might be time to talk with a surgeon about revision hip surgery. Welcome, Dr. Ebert.
Thank you for having me today.
So, what are some of the causes for failure of the hip replacement?
Causes for a failed hip replacement are four. The first most common reason is called aseptic loosening. It's where the implant debonds from the bone it's attached to. This can either occur on the socket side or the stem side. The second type would be wear of some of the parts of the implant. Typically, it's the plastic, which is in the socket, and that wears down over an extended period of time. The plastics are much better now, so that doesn't happen very often. The third has to do with wear of other parts, which can cause parts of the tissue to be eroded and create levels of instability about the implant. So the hip would present as something that dislocates or comes out of the socket. And the fourth would involve an infectious process, of which we're not going to talk about that particular aspect today.
So, what are the signs and symptoms of a failed hip replacement?
Most frequently, it's pain, and the pain has particular characteristics. So the patient will have pain in the groin or in the buttock area, and that would many times relate to a loosened acetabular component, or pain in the thigh, which would relate to a femoral component. They can also have a characteristic called startup pain, where a patient will stand up and stand on the side that has the joint replacement and have a tremendous amount of initial pain. And then after using the leg for a period of time, the pain will subside. And that typically is characteristic for a loose femoral component, which is in the thigh. Those would be the biggest factors that we would see with a failed total hip replacement.
So, what are some things that you might see on the physical exam?
The physical exam would be first an evaluation of their gait pattern. They'll have a limp where they'll favor the side that has the total hip replacement. They might have a restricted range of motion where rotating the leg internally or externally produces pain and limitation. The leg may be shorter, so the leg may have shortened because the implant slides down into the canal of the femur and becomes a shorter implant. Those would be all things that would be looked for on the physical examination.
And what do you do to rule out the possibility of infection?
Infection would be first studied by doing blood tests. If the blood tests are normal, then the likelihood of an infectious process is really low. Those blood tests would be a white cell count and a test called a sed rate and another test called a CRP. If those are elevated, then the potential for an infectious process would exist, and in that situation, an aspiration of the hip joint would be done and an evaluation of the joint fluid would be done.
So, what imaging studies are helpful to evaluate a painful total hip replacement?
Typically, we look at x-rays initially, and those x-rays are a view of the pelvis both from the front and from the side. Serial x-rays, meaning x-rays that are taken now and then 6 months ago, a year ago, and looking at the position of the components gives us an idea as to whether or not that there's been a change in the position of the components. Other imaging studies that we'll do will be an MRI, which is many times very helpful to look at the soft tissues around the hip joint. And we may also do a test called an arthrogram, which is a dye study where we inject dye into the joint and move the hip under X-ray evaluation to identify any instability patterns about the hip.
What causes causes the components to loosen?
The components can loosen for a number of reasons. There can be a significant level of osteoporosis or osteopenia that can cause a patient to have loosening. The patients generally have an implant that has no bone glue or bone cement. And sometimes when the implant is inserted, it does not ingrow. It doesn't occur very often, but that can produce a soft tissue ingrowth, which is not a permanent bond and will tend to fail over a period of time. You can also have wear particles from the plastic, which can then produce an inflammatory reaction in the joint and cause loosening. There can also be metal particles, which can cause loosening as well.
So, what happens when the plastic wears out or the metal frays?
When the plastic wears, it causes an inflammatory reaction in the joint. Many times it produces much pain in the joint, particularly in the groin. And we see a change in the characteristic of the position of the implant, which suggests that the plastic is worn. That can produce also dissolving of the bone called osteolysis. In the picture that's illustrated, you can see a dark area just above the socket, and that's a large area of osteolysis within the socket. And when that starts to appear, that's a time where the plastic needs to be changed, and sometimes the socket even needs to be changed.
What creates a total hip instability or a dislocation?
Typically, we see a change in the position of the component. So the component on the socket side becomes more vertically oriented. The component on the stem side becomes rotated, and that can cause the hip to dislocate in a particular position. Sometimes because of the wear particles, it can affect the muscles around the hip joint, and as a result, that can cause a weakness, and that weakness can cause a dislocation.
What happens when metal particles wear around a hip replacement?
The metal particles can wear, and typically it's cobalt chrome, and it's found with cobalt chrome heads wearing on the stem part of the femoral component. When that happens, the cobalt chrome particles get in the soft tissue, and they can cause an inflammatory reaction, which can cause the osteolytic process that I talked about earlier, as well as a soft tissue process that can affect the function of the soft tissue and actually deteriorate the soft tissue. That's called trunnionosis. And when that occurs, it's important to identify it, and it's important to exchange the metal ball to a ceramic ball. That's why with implants today, we don't use cobalt chrome any longer. We typically use ceramic, and that negates the development of the metal particle process.
What goes into the revision planning?
The revision planning, first of all, is a process that involves an evaluation of the cause for the instability, the cause for the loosening, or the cause for the problem about the hip. And once that's identified and what then is necessary to reconstruct that, that determines what goes into the hip revision. So it could be as simple as a plastic removal and insertion of a new piece of plastic, or it could involve the reconstruction of the socket or the reconstruction of the femur with placements of extremely long stems to allow for a stable hip.
Dr. Ebert, thank you for walking us through the reasons why hip replacements can fail and how revision surgery is planned. We really appreciate your time and insight you've shared with us today.
Thank you so much.